And those who are new on the platform, hi, hello, you're all welcome. As you can see on the screen, and as already mentioned, my name is Josephine Mwedekeli, and I'm very excited member of Forever Living Products. As for me personally, it's been a very interesting journey since 1995, and every day I feel blessed for being a member of this amazing company. And I also thank my maker for giving me good health, and together with through the usage of the Forever Living products. So today, as you already seen, the topic is understanding and management of toxic colon. And the reason why I've chosen this topic today is because in this nation of ours, there's been an increased incidence of cancer of the colon. And within the last 3 months, I've heard about 5 people passed away after being diagnosed with cancer of the colon. I know one personally. It was actually, it was a user of Forever Living products, was doing very well until his wife discouraged him. And the next thing I heard is that, oh, they got somebody who's a family member who's now joined Forever Living products and they'll be buying from her. I don't think they ever did. So just about 2 weeks ago, unfortunately, it passed away. It was taken to India, which is the usual case. Okay, they always package it to India, and the Indian doctors will never refuse. And what happens in most cases, they package them back here to Kenya, and within few weeks, they find they're no longer here with us. So apart from, I was in a meeting when I was in an event on Saturday, and I was discussing with my newly found friend on the same table, and they were telling me about the same issue, that they had friends who also they were diagnosed with colon cancer, and they're no longer here with us. So this is what has actually prompted me to this evening to choose this topic, to see how we can help many people there, how we can help them to actually preventing them from being a victim of cancer of the colon, which can actually be prevented. So uh, you can now understand why I've decided to choose this topic. So welcome again, and please do listen intently to the presentation. I've got a lot of information to offer. I will try to be quick as much as possible. So sit tight, and again, make sure you have a pen and paper. And if you don't already, if you're on those products for brain health, like omega-3 fish oil and many other products for memory enhancer, or if you're on them, then you'll be excused. If you are not, or photographic brain, if you are not, I will advise you to listen intently, and then just learn a lot of information I'll be passing along. So let me move on. You're all welcome. I know some of you are not from Kenya, you're outside of Kenya as well. So also, you're also welcome to this presentation. So as you can see from the statement here, gut health is critical for good health. I hope you all understand that. You agree with me. I always tell people that be the CEO of your health. Don't leave your health in the hands of any doctor or your pastor. Take charge of your health, because this is critical, because nowadays we're eating a lot of rubbish that is causing a lot of digestive issues. So this is why I said your gut, and as you can see, apart from this statement you're reading here for yourself, 95% of medical challenges are actually, they are associated with gut health. So this is why it is critical to make sure we look after this area of the digestive system, especially the colon that I'm focusing on today. Nature's the best physician. That was by a famous doctor called Hippocrates, who was coined as the father of Western medicine. So that's what we're going to be dealing this evening, toxic swollen colon syndrome. That's dealing with it in the most natural way. So digestive health are often the cornerstone of many individuals' chronic health problems. Unfortunately, when we're talking about conventional traditional medicine, They don't understand the significant role that the digestive system plays an issue in many patients' health, especially when in terms of chronic, those who have been diagnosed with chronic health issues. They don't understand. That's the modern medicine. Okay, many of them, they don't even believe when you're talking about supplementation. They don't believe in that. They believe in those conventional drugs, which are the third leading cause of death. I'm not discouraging anybody here from taking conventional medication. For me, as a complementary practitioner, I believe there's a role for it, especially when we're talking about acute management. Yes, because our products, they don't work quickly. So if somebody is on medication, I never ask them to stop. I always tell them, continue with that medication prescribed by your doctors, okay? And again, gradually our products will be removing the side effects of those drugs, and eventually we get better. We start gradually winning them down to convert them to using our products, as you'll be seeing later. So how healthy are you? And I hope many of you are able to answer this question. Are you 100% healthy? Can you consider yourself that 100% healthy? This is why I always like doing physical presentation, because by doing physical presentation, it actually helps me to look at the mood of the people in the room and judge their response. So, but because it's not always convenient, this is why we are now doing it on Zoom. So let me talk, since we are talking about the large intestine, which is also known as the colon, very important for digestive health. It has three primary functions. You can see there, it's very important because it's very important when we're talking about absorption of water, okay? The water goes back. That's where the deposit gets dry. And so it's very important for absorbing water and electrolytes like sodium, potassium. Those are all these things, very important. I don't want to be too technical here, but those are examples of electrolytes. And again, it's very important. Another primary function of the colon is very important for producing and absorbing vitamins. When we talk about vitamins, you find the large intestine is responsible for the production of vitamin K and the B vitamins, and also what we call the butyric acid. Those are the butyric acid. They're very important. They are made by those beneficial bacteria from fiber. And they're very important for the repair of guts, inner lining, and for general immunity for general immune system. Very important. And the last one, forming and propelling, getting rid of feces towards the rectum for elimination. Okay. I hope you understand that. So when this system is working properly, good health and high energy is often the resultant effect. Okay. Yeah. But if the bowel, now when we're talking about this colon, when it's unable to extract adequate nutrition from the food, or if the waste matter, those feces, if they're not being completely removed from the body, what happens? Your health can suffer terribly. So just a note there, I said the friendly bacteria present are known to produce, which I already said, vitamin K, the B vitamins are together with butyric acid, which I said is very important for the repair of digestive lining. So now look at the baby, innocent baby there. You can see there, very happy, we should, all of us, not only babies, should have a smooth bowel movement on daily basis. We adults, we should all be like babies. Not babies within an hour, even within an hour of eating. In normal situation, they're able to exit. They pass the stool and they're very happy. That's nature's way. That's the natural process. That's what should happen. Look at that. She is so happy after that. But what's happening is what we're talking about today. In most places, what is happening nowadays, it does not happen to many people. I will tell you more as we proceed. So let's examine the anatomical area of the digestive system. You can see there the gut is from your mouth all the way to the anus. God is an amazing God. The way it's packaged everything together. And if you stretch it out, oh no, my God, I've seen a lot of postmortem patients and anyway, don't let me talk about it. So our God, our Maker, is an amazing one. The way it's packaged everything together. Let's say now, if you stretch, you can stretch out all this Now, stretch it out, they cover a small football pit or football area. Yeah, that's how long it is. And we're able to package without us knowing to package everything going smoothly for us. Now, this area we are interested in today. Okay, that's the small intestine inside. And here, you can see this is the large intestine. This is the colon where we are focusing on today. We call it the big intestine. You can see there, that's ascending colon, that's transverse, and this is descending colon. So, and again, extend it to the rectum to exit the feces. That's the appendix there. So that's the normal anatomical arrangement. Now let's see. Science and toxic overload. Here are 4 clues to what can cause real problem. The first one said, does your belly remain stubbornly bloated? This is what is happening to many people nowadays. You know, they suffer from all these conditions. They feel very, they feel bloated all the time. These are the questions I ask when people come to me for consultation. I always ask people, as I said, 95% of medical challenges are from the digestive system. So I ask so many questions when I'm being approached for consultation. So these are the things I ask about to make sure the digestive system is not being challenged. So many people, you find that they feel bloated. You find that they have so many issues. Even when they exercise, they still have issues. Okay. Number two, you can see, many of them, they sit in the toilet for a long period. So do you sit in the toilet for a long period? Straining. This is where there's problem within the colon. Grunting, trying to get things out, they pull out, and only be disappointed when they start producing scanty result. Like the rocket, no, it comes out like a rabbit pellet or like a goat's poo. And sometimes because of the problem there, they get watery discharge. These are all the things I always ask when during consultation to make sure that they don't have issues with the digestive system, with this area of the digestive system I'm talking about today. Do you sometimes go for days? Some people, I remember one guy came to me a few years ago. He said, Madam, I'm in trouble because for about 10 days I haven't been to visit the loo. This is what is happening more and more, and they are getting younger. Okay. Normally, all this is associated with people over the age of 60 upwards. But nowadays, they're getting younger. Age 40, age 35, because of so many things we'll be talking about later for your better understanding. So, do you sometimes go for days or weeks without having a satisfying empty bowel movement? This is what is happening nowadays because of rubbish we are consuming. Number four, do you find yourself resorting to laxative? This is what happens. They go and buy it, the chemist over the counter, they be asking for all these different laxatives or anything they saw, you can see there. And even sloppy, embarrassing animals, that's what they resort to get things moving down there again. This is what is happening to many, many people nowadays because they feel sick. They are looking, when we're talking about, they want a quick result. So this is it. You stay on the toilet for a long period. This is what I was saying. These are the examples. Grounding. They can because of they are the area we're talking about is problematic. Hey, this is serious. You can see here, yeah, immobilized. We get traffic jam because of constipation. Yeah, and fewer 3 bar movements. You can see per week. This is quite serious. Huh? Majority of people today they're not completely empty their bowel and and full of noxious waste every day. This is not what the way nature intends. Look at this. No, this is a bloated stomach. Does your belly remain stubbornly bloated? This is what is happening. Yeah, over your bed line, despite the best effort to exercise and diet, it away. Many people they are like that, swollen, looking bloated. Look at the stomach, as if they're going to give birth tomorrow, because there's a problem within the colon. This lady, you say you are not fat, you just suffering from swollen colon. This is it because of the poor digestive health. So let's look at this one. This is the entire process, which should be easy in a most natural way. This diagram is showing that. Is your colon swollen? With kilos of toxic or decaying old poo, because that's not a laxative. It's not the job for a laxative. This is the normal bowel movement. You have this muscle, you have muscle there, which controls the movement is called peristalsis. Okay, so it controls the feces to push out. Very, very important. That's the work of the muscle. And again, so it gets pushed down. This is the normal. This is the normal. In normal case, this is what should happen. If these muscles are working properly, doing their job to get rid of this waste product of feces. Look at this one. This is the inner side of the digestive system of the colon. You have all this. This is a toxic effect. It's full of, look, you can see old poo, accumulation, horrible. They start to ferment. And the bacteria, we have good bacteria, bad ones there. So the bad ones start to ferment. They start to eat this accumulated poo. They start to eat it, and in the process of eating that, they also produce a lot of toxins. And with the production of toxins, you get inflammation. With inflammation of this inner lining of that colon, with inflammation, you get ulceration. With ulceration, what happens? Cancer. So it's a process. But many people, they don't listen to their inner self. And eventually, they end up being diagnosed with cancer. So this is what happens when elimination is incomplete. The residue of old feces can build up in layers on the wall of the colon. Now they start to putrefy, as I said. They can cause health problems, pain, and discomfort. This is why you see some people. I remember some people in the past when they come to see me for consultation. As soon as they open their mouth, they have digestive issues. Their mouth is like sewer. Huh? Not to, and they be passing wind both ends before they even tell me, because of what because I'm very, very observant. Because of because of those two areas, I can tell that before they open their mouth and tell me whatever is wrong, I can always guess that they have issues with their digestive system. So this is what I was talking about with impacted feces. Now it stays there for a long time, and you get putrefaction, and those bacteria start eating, and they start to produce a lot of toxins, either with inflammation, ulceration, and cancer. This is what happens. This is what we don't. This is why we're doing this training today, so nobody become a victim eventually of cancer of the colon. So look at the statistics here. You find this was in Europe, a medical study was carried out, and they made a very shocking discovery. They found that 62%, imagine 62% of adults whom researchers were examined, they were found to have about 5.5 kilos of residual fecal matter build up. In other words, it's just like we say, all decaying poo in the large intestine, the colon, and also extended to the rectum. This is what is happening. In Africa, it will even be worse. I know we cannot say because of now we are copying Western diet, not eating enough fiber, and many other things I'll be talking about later. So this was according to a medical study which was done in Europe. So let's get back again to our physician, our Greek physician. He said death begins in the colon. For me, I say as a clinical nutritionist, I say health begins in the colon, because I know we have a way of actually preventing that, to make sure people, they are able to achieve optimal wellness in that area of the digestive system. So look at the resultant effect of constipation. When they keep on straining, this within the colon, it's straining. When you go to toilet, you can't pass. What happens? You find the veins. You end up having. I'm sure some of you heard about some of you. You've heard about these conditions with people. Some of your custom community complaining of hemorrhoids or piles at the backside. This happens because of continuous straining. Due to constipation. You can see they have inner one, hemorrhoids or piles, and then the outer one. And again, don't forget, stress can also worsen hemorrhoids. We'll be talking about that, the issue to do with stress. It's associated with constipation as well, which is also on the increase nowadays. Many people are stressed. I can tell you that. Not only in Kenya, globally, I can tell you. So another resultant effect of constipation, we find that the immune system is weakened due to buildup of all these toxins, okay, resulting in infection and disease. So as a result of that, the body can become poisoned from that waste, as I said before, okay, because of too much toxin being produced. But this is referred to as auto-intoxication. which is it is the cause of over 90% of the disease of civilization nowadays. That was by Dr. Harvey Kellogg, medical doctor. Can you imagine? This is what is happening now. More and more is happening. This is another look at the signs of toxic overload and the resultant symptoms. Now, what are the things you find that constipation, bloating, as I said about the person passing gas through those two areas, headache. Of course, when you have built up the toxin in the colon, you get inflammation. The body is gonna start complaining, headaches. And what happens? Many people they don't know there's a problem within that area of the digestive system. They start looking for maramoja this, maramoja that. Quick result. You suffer from fatigue. Of course, you're going to get tired. Because when this happens, you find that the mitochondria, which is energy produced at cellular level, they are no longer there, they're getting depleted. Aches and pains, nausea, belly fat, like that picture I showed you before. Skin issues, they start having what you call eczema, they start having pimples because again something is wrong. The body that area is toxic, and now it's reflecting on the on the skin. They start complaining about they are craving for food, which is wrong. Low energy, as I said before, bad breath. Of course, you're gonna have as long as they open their mouth, it's like a sewer, because the old digestive system is packed up. It's horrible. It stinks because they cannot exit. Obviously, they're going to have issues with mood swing. Constant chronic constipation can, as you can see, equals to colorectal cancer of the colon. This is the typical end result, which is happening more and more now. This sad, very, very sad scenario. Look at this picture. The colon cancer is the second cause of cancer death. And you can see, we call this, when they do endoscopy, okay? Sometimes I ever, because of my background, I always ask patients, have you been this for this? So people come me to for consultation. Have you had this done? Have you had the barium test done? Have you had the occult blood test done? All this, because all these things is what I used to do before. And I ask patients and refer them to. I always ask them. So something because they don't know. So through consultation, I'm able to help them to seek medical diagnosis. You can see that when they do endoscopy or colonoscopy, most to be precise, here you can see, all these things, this is within the colon, the big intestine. We call it colon polyps. These are all growth, okay? All growth here, which they can, if they seek medical help on time, before this can become cancerous, they can be removed. And then with our products, you find out will be the end of it. Take a look at that. Now you can see it now it's becoming cancerous. This is what is happening more and more. And they're totally, as I said, they're getting younger. Look at that. That's what it is. This is what you've seen when they do colonoscopy. And this is why now they're advising people over the age of, from the age of 50 upwards to be going for colonoscopy. Even now they should reduce it to 40. Even 35, because of the diet and so many things that were because of bad habits. So they should try to reduce it, no longer just limited to age 50. For everyone, anybody from age 35 should go for colonoscopy. Now, this is the end result I was talking about, cancer of the colon. These are the end result. You see here, 61 of signs of bowel cancer. You can see start having blood in the poo. This is, I say, Junior, in those days, this is what every Friday used to make me to do. We call it occult blood. Where now you test to start gather all those T feces. And you start doing tests on it to find out, because inside you start doing the thing with the poo. And some of that, as I said, they're like rabbit pellets. It's horrible. It was as a junior, it's a horrible experience. And now you do a certain test to make sure to find out whether there's blood. Because if there's blood there, we call it occult blood test, then that's suspicious of cancer in that area, in that specimen, in that area of patient specimen. Okay, you find that another thing be changing bowel movement, obviously, as already mentioned. Weight loss, this is quite serious. When somebody comes to me and says that they're losing weight, they're not able to pass stool, I always say I get so worried, I get so concerned. I said they should go for emergency diagnostic test, and they should bring it back to me so I know what is happening, because I cannot just recommend products anyhow. I have to know what I'm dealing with. Probably it's already stage 4 cancer. So this is what is happening. Weight loss. This is part of evidence of cancer in that area. Obviously, as I tell, they suffer from chronic fatigue, pain or lump. You can see all those areas. You can see obstruction, obviously, because of those impacted feces. Look at the surgical specimen. Look at this. This is a surgeon displaying segment of that swollen colon. You can see there, after they've removed from a patient. This is really, can you believe it? From a patient, look at that. Look at that. It's quite serious. Now, if they remove this part of the colon from a patient, what they normally have to do, they do what is called, they carry a bag, okay? They have to attach a bag for them to be emptying the poo, because they cannot, it's a big area. No, knowing that the length of the colon itself is about 1.5 meters, okay? Like 5 feet, okay? But if they remove this portion area, this person they cannot do a resection. No, they can't. The area is affected. So they have to start carrying a bag, which is very unpleasant for many, many people. So this is another one, which is at autopsy. Now, somebody is, no, they can't save it. Look at that, look at it, look how big it is. This is what we are talking. It's a serious issue. This one is even gone past stage 4. Okay? The metastasis everywhere. Look at look how the colon is. It's terrible. So we are talking about serious issue here. So here, in your digestive system, we have these good bacteria, as I said, produced by, we have good bacteria, you have bad ones, but obviously, if somebody is on antibiotics, they get rid of the bad ones. They're not, let me tell you, antibiotics, they're not specific. They kill both the good ones and the bad ones. And the person now becomes, the immune system becomes challenged. You can see that these bad microbes, it causes increased inflammation of this area of the colon. Then what happens? Poor quality of life. Very, very important knowledge to acquire today. And we're talking about antibiotics. We are eating, doctors are teaching, they are dishing antibiotics are like sweets. Everything antibiotics. I'm not against antibiotics for acute management. But when you say extended for 2-3 months, which I've seen some people coming to see me, they one after the other, they are not good, because they damage the inner lining of the digestive system. They affect your immune system. They can even cause what you call autoimmune disease, because it causes leaky gut, as you said in my previous training before. So you find that we are not only taking those ones from the doctors, also even the meat we use, the beef. The beef we eat, those cows, they are fed with antibiotics, so they don't die before they get to the slaughterhouse. Apart from growth hormones they're being given. Huh? All this rubbish we are taking. These are the problems. Now look at this. Look at the inner lining of the colon here, of the big intestine here. Before, when everything is normal, you have a population of good and bad bacteria living happily together. The moment somebody starts taking antibiotics, what happens? All the good bacteria are wiped out, leading to low immune system. What is actually interrupting the natural flow? Most common causes are, you can see that before I forget, exposure to glyphosate. Glyphosate is what we use on the farm. The farmers use on the farm nowadays, which is classified as a class 2 carcinogen. Okay, that's how they use it for. They use it for when there's like this weather. Now, if you're a farmer, you have grains and you can't dry because the weather is not good. Then they spray glyphosate as a desiccant, or they also use it as a weed killer. So they are using it a lot in Kenya, apart from some other countries. So they are known to be toxic. Okay, to cause cancer. It's a known cancer causing agent. So imagine that when somebody is exposed to glyphosate, can be one of the main causes of cancer because of environmental exposure. And many workers on the farm, they are not protected. There's no law for them to have all those gears to protect themselves. It's it's a sad situation. So another common causes of all these problems affecting natural flow is ignoring the urge to go. Now, when you have to go, you have to go. Don't delay. Because when you keep on delaying, what's going to happen? That feces will not be able to come out. And the longer it stays there, the more it gets impacted. It gets dry. And it can lead to constipation. We are eating rubbish nowadays. We are not eating, especially guys. Hey, guys, they internalize a lot, and they're very poor when you talk about the consume dietary fiber. If you ask many guys to eat salad, they think it's for rabbits, these are non-digestible fiber, very, very important. for to give the push. They don't eat in the fruits. What is it? Research was carried out in this nation about 5 or 6 years ago, and they found that out of then the population was about 50 of Kenya was about 50 million. They found only 6% of Kenyans actually consume 5 portions of fruit and vegetables on daily basis. Very sad. No wonder we're a sick nation. Insufficient fiber and consumption or increased consumption of how this processed food, highly processed food, no nutrient, no nutritional value, devoid. Now, when talking about this, there was I don't eat. I think I eat what you call ugali once, maybe once in 6 months, and I don't eat just ordinary ugali flour. I don't want to promote any company here, but I'm very careful the type of ugali I take. I look at it to make sure it's all mixed, sorghum, and not only just. Okay, listen, what am I talking about like this? When we talk about highly processed food, because I know in this nation, the main food for many people is ugali every day. Okay, so they said in one car packet, I won't mention the company's name. I went to the shop because I normally buy things for my helper in the house. Okay, so they said that new improved. And when she was making that ugali, it's like the pap they make in South Africa, devoid of all this essential fiber, gummy, gluey, just pure white, no nutritional value at all, no fiber. Everything is so processed. This is what many people consume in this nation. And here, medical condition like 1 in 3 diabetics, according to research, suffer from constipation due to side effects of medication, which will be seen on another slide. Like when people, if they're on dose of medication for like codeine, any medication containing codeine, or we call it opioids type of medication, they can constipate somebody like no man's business. You start passing through like goats. Those medications, they are for headaches and one of the maramojas. Okay, so look at here. Depression can even slow down the body process, leading to constipation. Many people, because they're suffering from, like nowadays, depression, so they increase, and when they go to the doctor, they dish out to them, they give them antidepressants. And antidepressant is known to interfere with that muscular movement called peristalsis, inadvertently causing constipation. As I already mentioned about medication, all these are medications, okay? Like similar to paracetamol, all right? Antibiotics also another one, as I said, antihistamine, all these antipsychotic, calcium channel blocker, which is all these things for people with heart issues, beta blockers. These are known to cause constipation. There are diuretics, like Lasix. They are known to cause, these ones, they are, for people with, especially those who are taking high blood pressure tablets. One of the side effects is swelling. The body becomes sort of get edema. So they have to now give them diuretics. And diuretics are known to deplete the amount of minerals in the system, and again, making the feces dry, causing constipation. And all this, look at another one, non-steroidal anti-inflammatory drugs. Many people are on this medication. No wonder they're complaining of constipation. These are the side effects of conventional medication, to make you aware. Hey, Jean, no, this is a natural process, okay? We are bound to get old, okay? Older people, the system that's been working for over 70 years, it becomes sluggish. It's not as active as before. That muscle causing a peristalsis is no longer functioning as when they were in their teens. This is very common among the old people. They often suffer from constipation. This is why we have to. I was giving the training to people looking after the old people and teaching them how to take care of old people, especially with their diet, making sure they have a lot of fiber in their diet in order to make sure they don't become a victim of constipation. So here, female gender, women are 3 times as likely as men to suffer from constipation. This is what I was talking about, stress. Stress, which is on the increase in this nation, apart from the globe being a global issue as well. So stress, when your body is stressed, it produces cortisol. And those things, they constrict, they affect that area, the colon. They can cause constipation. There's a direct connection between the central nervous system and stress when we're dealing with what can affect that natural flow. This is what I was talking about when we're talking about codeine, all this opioid type of medication affecting that movement of the feces, making it dry, causing constipation. And most causes are known. Obviously, I was talking about inflammation, which is can be the resultant effect of constipation, you know, leading to ulceration later and then cancer. So those are the common factors. Again, people on stimulants like coffee and tea. Some people they're so addicted, they're addicted to these type of things. We know that coffee and tea they're diuretic. And what do? They are known as stimulants. They can cause, you want to be constipated. Some people, it's not everybody, but some people, because of a lot of, due to high consumption of dairy products. Also, according to research, it's not me, this is according to research, they suffer from constipation. Excess alcohol can cause, in this nation is also on the increase, okay? People consume a lot of alcohol. We know alcohol is an oxidant. It's also known to affect the normal flow, causing constipation. Look at this. This is what is happening in this nation. Many people, yamachoma, yamachoma, too much meat. Meat causes acidity. And when you keep on consuming acidic food like meat, no enough fiber, you are taken together with alcohol. This is now you are this is en route to constipation, eventually cancer. This is what is happening. Too much meat causes cancer loves acidic environment. And you know that too much meat can cause can alter the pH of that area. This is what is happening in this nation. And again, I was talking about highly processed food. This is it. When you're talking about general wellness, this one cannot confer any general wellness at all. You see, this is all junk food. Trans fat, all this. There's no nutritional value, no fiber. This is what people consume on regular basis, occasionally as a treat, but not making a habit of it if you really want to have good colonic health. You can see all this. You can see when they say they're making chapati, the flour is pure white, highly refined chapati. Even there was a report there was a company producing fake ones, fake chapati flour some years ago. Look at that. White, no nutritional value, no fiber. And this is what people eat day in, day out. And by the time they say they're eating vegetables, so that vegetable is not proper, it's been cooked to death. Look at the garlic, too much refined. Look at the vegetables they're talking about. You can call it fiber, but he said there's no nutritional value, it's been cooked to death. And that's a lot of mystery as well. And this is what most people are consuming and they want to be healthy. Can you imagine that? Look at this. This is all junk food, trans fat. This is also just in the middle. Kanye's favorite here, containing nitrates, carcinogenic. This is all too refined. And you even put all those things there. You cannot imagine why people are sick. Look at this. This is all junk food, no nutritional value. You can't be well. You're going to be constipated, especially when you're not taking enough fiber, not enough water. Okay? So this is now talking about inadequate water intake and then sedentary lifestyle. People they don't exercise because exercise is very, very important. They sit most of the time. They don't go for exercise because when you go for exercise and you're drinking enough water, you're taking enough fiber, obviously, naturally, you will not be a victim of constipation. I can tell you that. These are the ones they go for. Now, people, they have what you call microwave mindset nowadays. They want quick result. What do? Over the counter, you'll be looking for laxative. These are the things. You can see there, which are known, they can cause damage. But they can damage the bowel nerves, which inhibit natural peristalsis. With that movement, can affect that movement, that muscular movement, for the feces to exit. You can see that those are the things they boil. All this in senna. Okay, this is a plant. This is plant, but it's known. It cannot correct the impact of toxic colon on its own. This one, when you boil it, this is a senna leaf, and it's also it's known to actually get normally they said it's very good for bowel movement, but again you find it's going to dehydrate and again deplete the amount of minerals in the system. And you need minerals. You need minerals and vitamins. Those are the essential micronutrients for good balanced colonic health. Here. Okay, common side effect of senna, due to what I was saying before, that when they boil, abdominal pain, discomfort, cramps, electrolyte abnormality, low potassium, feeling nauseated all the time. Those are the plant. So because it's plant-based, it's natural, it's got side effects. Imagine. Now, I don't even see these people, this clinic, I don't see them anymore in Nairobi. They used to be all over Nairobi before. They call it colonic irrigation and clinic. Used to be, those maybe about 15 years ago, 10 years ago, they were all over in different parts of Nairobi. And they call it hydrotherapy. Okay, this is what they used to do. They think because the notion is that if you are constipated, they have to get rid of it. So they have these clinics where they first they give you what is it? They pass water through pass water through the anus, through to the colon, and in the process of that test or whatever they're doing, the therapy, in the process, the nerves in the within that area, the colon can be damaged because during the insertion of the tube, all right, and again can disrupt those the gut flora as well. And after that procedure, which is very expensive, definitely you have to go for about 5 treatments in those days. Okay, very expensive, and it's not a permanent solution, mind you. And so after that, they give you yogurt. They say, okay, they give you yogurt. They say that yogurt contain natural gut bacteria because to replace the one which the tube through insertion would have damaged. Which doesn't make sense. In theory, it works. In practice, it doesn't work because those bacteria there, I mean the yogurt present, the bacteria present in the yogurt, they can get destroyed by digestive juices, so they don't reach that area where they are needed. Don't forget, because we'll be talking about probiotic later. Okay, now side effect of colonic irrigation, vomiting, nausea, that during that procedure. And this is what I was telling you about perforation during that insertion. It can cause infection. They can get depletion that's of good bowel flora. Yeah. And again, they can even, one of the side effects is kidney and heart failure during that procedure. Because some of the people who are below, they're not especially, they are not qualified to be operating that system. But I'm glad I don't see them anymore around. So now let's talk about the natural nutrition approach. I'm glad that many doctors, because they have to start learning about, it's not, drugs is not the only way forward. They have to now start learning, doctors, because the patient, because of information, because of technology, patients are now asking, they're going to doctors that advise them about what to eat and not what to eat, so that they don't become a victim of cancer of the colon. Now, I'm glad that doctors are now advising that they should now start to eat all this. These are all sort of fiber. Like this one is red onions, which we have plenty of them in this nation. We are very blessed. I can tell you we're very blessed in this nation because in some other countries they don't have this. And before you can reach out, you have to go far to be able to get this type of basic food these basic products. I'm talking because I've traveled worldwide, especially in Africa. So we are very, very blessed in this nation, except that we are some of the produce they are now genetically modified and then being sprayed with glyphosate, which is very, very unfortunate. Now, this one contains a lot of prebiotic. This is the red onions, very, very important for that area of the colon. And all these are good fiber, contain essential vitamins they're supposed to, all right, vitamin A, all these are macronutrients for good health. You can see garlic there, very, very important for digestive health. So these are natural nutrition approach. Vegetables, they are known to detox the colon, very, very important. These are all these vegetables we are supposed to be consuming. Like broccoli. What happened with broccoli? This is my favorite vegetables. Before I cook it, I have to make sure I soak in sodium bicarbonate to get rid of those pests. And also whatever they may have sprayed on it, so I don't become a victim of cancer. So you have to soak it for 20 minutes before I start to sort of stir fry. Broccoli is very, very important because it contains anti-cancer properties. All this cabbage, they're known, all these vegetables are very, very important to form the bulk for the colon, to give the push. They're very, very important. And when you cook them, don't cook them to death. This is why I say stir fry in good oil, not with those type of oil they set to at room temperature. I don't want to mention any company's name. No, cheap can be expensive. There are many oil that we should not be consuming. All right? It can clog the arteries. So look and see skooma, very, very important. Why? Because they contain sulfur. And sulfur compound is very, very important for the colon. Helps to support detoxification. And they all contain what you call good antioxidant known as glutathione. Very, very also important for the liver when you're talking about detoxification. This antioxidant uh, 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 property. Okay, and fiber this fiber contained within nature's ultimate toxic metal binder. All these things, all these vegetables they contain, they are very, very important because they help us to make sure that any toxic metals, they help to bind them and remove any, especially those heavy toxic metals in the food we consume. So very, very important. As long as they're organic, as long as they're not sprayed with the glyphosate, as long as they are not genetically modified. This is, I'm talking about organic vegetables here. These are examples of them. You can see we have a cauliflower there, we have cabbage. Oh, no, I hope you're all familiar with this because we are very blessed in this nation. And then when you cook them, you can even cook them with turmeric because turmeric, as one of the spices, king of spices, for a very good for colon detoxifier. Very, very important. These are classified as cruciferous vegetables. They are super contain antioxidant to get rid of free radicals. Salad, this is why I said that they're very, very important. They're soluble fibers. We should be consuming soluble fibers like also oat and flaxseed. Very important for the digestive system. Now, this is why I said people should be eating for colonic health. Water is also, as already mentioned, water minimum of 2 liters a day. We're not talking, stop drawing on my slides, please. Emmanuel, I sent a message earlier on. This is a very sad person drawing on my slide. It's not acceptable anymore. They do this every time somebody is presenting. I don't like it. And shame on that person. Here, we have water. Water is life. For maintenance of optimum health, you need water. Without water, you get headache. Those toxins will not come out. You need water. Even if you're using a supplement, you still need water. Otherwise, you're wasting your money. So water is life. We're now recommending about 2.5 liters of water. For the guys, 3 liters of water because of increased body weight. So here, water is critical to get those so that you don't become a victim of constipation. I mean good water. I'm not talking about those toxic water around. So you can see all about miracles of water. Very, very important to cleanse, to get rid of any toxic waste from various parts of the body. Without the flow of water, there's insufficient water to remove waste and toxins through the stool. So the toxin will continue to accumulate if you don't have enough water. That's why you start passing stool like goat or rabbit pellet. Very, very important. Water is essential. Exercise, this is what I say about exercise. When you exercise, no matter what, you are eating properly, good fiber, you're drinking enough water. When you come after exercise, you're gonna exit, no matter what. You will exit, you not be struggling in the toilet. Okay, sleep helps, the importance of sleep. When you sleep, which many people, they are not sleeping properly now, adequate number of hours. Good sleep, it actually helps to relieve stress. Stress is also associated with the colonic issues. So, good night's sleep, very important for cellular repairs and many other things for general wellness. Very, very important. Research shows how crucial healthy gut is for overall general wellness. Very, very important, including mental and emotional health. You can see there, when we're talking about the digestive system, it contains over, you can see we're talking about delicate area, the colon. It contains over 100 trillions of organisms that serve the purpose within your microbiome, which is a combination of virus, bacteria. As I said, those good ones, they all live happily together, microbiomes. I've already trained on this in the past, so I don't want to repeat. So they are over, as you can see, over 100 trillions of them. They all live happily together until you start taking those antibiotics. So 5 areas of health and wellness linked to gut health. You can see, as I was saying before, poor nutrition diet, weight gain, obesity, obviously. Some people look because of obesity, everything, accumulation of those, of too much, you're not able to exit, increase in weight, autoimmune disease, as I already mentioned, because of those medications and antibiotics, due to leaky gut syndrome or system and disease. Brain health also is also part of it. Obviously, if you are not able to exit, you're going to suffer from depression and you're going to have chemical imbalances. At the end of the day, cancer can result. So a good probiotic diet is essential for your colonic health and wellness. Let's talk about that later. Now, this is a natural nutritional approach to forever living products. I hope you're all awake. Now, this is for new people who are on the platform today. We have what you call prebiotic. Prebiotic is very, very important. This is an example of prebiotic, and you can see on the list, aloe vera is first on the list. Bananas, they contain what you call soluble fiber. You have soluble fiber, you have insoluble fiber. Okay, so soluble fiber is those one that gives the push, it gives you the bowel movement good push. So we also need soluble fiber, especially for those good bacteria, to increase the population of those good bacteria so they can produce those vitamin K and the B vitamins together with butyric acid, which are also already mentioned. So we have onions, those especially red onions contain prebiotic. Garlic is also very, very, you can see all these ones. So you have been, those are all classified as prebiotic. Prebiotics are very, very important. Without prebiotic, the probiotic will not work. This because prebiotic they act as fuel for probiotic to work. I hope you are listening properly for better understanding. I hope you are following me. And so you can see this is their special plant-based, non-digestible fiber. Okay, for bacteria, like as I already mentioned, like our aloe vera and the fiber. We have in Forever, we have what you call Forever Fiber containing inulin. We have those ones in small packets, especially in the C9, containing 5 grams of fiber for the digestive system, so you don't become a victim of constipation, especially when you're doing detox. So you get good bowel movement. We call it inulin. Those are soluble fiber. And again, what do? They stimulate the growth and activity of beneficial bacteria. So without, as I said, without a good prebiotic as fuel, the probiotic, they will starve to death. Okay? And what will be the resulting effect? Constipation and compromised immune system. This is what is happening. I've got a lot to present, so I hope you are able to understand me, and I hope I'm not talking too fast. So here, what are the probiotics? Probiotics, different from prebiotic. This is pro now. Probiotics, okay? What are their roles? These are good bacteria in the digestive system. So as I said, we have the good ones and the bad ones in the colon, okay? And the balance is very important for a healthy gut. So the probiotic, what do? They help you in various ways. They break down they break down and digest food, and they support overall gut health. They ensure that the immune system works properly in balance, and they also have a role in how you think and feel. Now, this is the link with the brain. Okay, there's a good connection there. The gut and the brain are all connected through the gut-brain axis. I did that in my presentation before. So the gut bacteria can improve in the production and the regulation of hormones. Very, very important. We have all those hormones like leptin, which is very, very important for general wellness, and the insulin, also very, very important. I will not want to go on that now. They've been found to produce a neurotransmitter, which was when I was training about on brain health. These are chemicals for your brain to work effectively. So there's a connection between your digestive system and your brain. Look at this serotonin, which is also produced in your digestive system. This is a very, very important. Dopamine. These are all the things. They play good role in your mood. So the connection between the digestive system and the brain, which I did before. So now I hope you're all awake. We're now going to talk about how the beneficial effect of forever living products can come to the rescue when we are talking about constipation, so that we don't become a victim of cancer. Okay. Look at all the benefits of our products through Forever Living Products, which is an amazing company operating for over 47 years, operating now in over 165 countries globally. So we are not like those other companies. They clap forever, because these are top standard, scientifically researched natural food supplements. They are not of this rubbish on the market. Some of those, there are so many cowboys in the system, producing supplements. Many of them, they are fake. They are not natural. And when you give something which is not natural to the system, okay, you can't deceive the body. The kidneys it washes them out. You end up having expensive urine. So some people, they say, oh, that products are expensive. It's quality. You choose. We are talking about health here. As I said, take your health very seriously. Treat your body like a temple. So don't just go and start buying those fake products on the market and say you're taking vitamins. You're taking vitamin A, vitamin D separately. They don't work like that. They work together synergistically with the vitamins. Very, very important. The minerals and vitamins, they work together synergistically. Synergistically, they work together. Good beneficial effects for general wellness. So now, benefits of organic natural food supplement for optimal wellness, very, very critical. Look, like the one from Forever Living Products here, you find organic, we have in Forever Living products, as you can see here, these are all food supplements. The organic natural food supplements, they are very, very important because they provide essential nutrients that complement the diet for optimal general body function. Very, very important. According to law of nutrition, these supplements, what do? They know to supply minerals, very, very important for general wellness. Vitamins, as I said, they all help one another. Amino acid, which is for rebuilding, the renewal, very, very important for cellular regeneration, and botanic support to support bodily process like your metabolic system, your immune system, and also for general growth, cellular wellness. Lack of these essential nutrients is known to lead to illness. This is when your body is deficient of all this. What happens? Cancer. We don't want it. This is an organic supplement. They know to contain nutrients in a form closer to nature, to natural food. This is why supplement. We say supplement because now we're eating rubbish. So they are not to all what they do, they bridge the gap in whatever is missing, the food you are eating. They enhance absorption and efficacy. This is the product supplement from Forever Living Products. You should clap for this amazing company. Some of the products you are buying from the Forever today, some of them they take about 3 to 4 years of research because they are not rubbish. I've been to the lab where they do all the tests. I've been with this company for so many years, since 1995. I know that they are top quality products on the market, Forever Living Products. And I always tell people, if you comply, this product do deliver. But many people, they don't comply. They treat it like medicine. This is why whenever I'm doing consultation, I have to educate them that don't just take it like medicine. Use them. If you use them properly, you follow this product, they do work for optimum wellness. What do they do again? The nutritional law emphasizes balance, intake of macronutrients. Okay, remember macronutrients like carbohydrate, proteins, and fat. And also, what do? They also take the balance of micronutrients. When we say micronutrients, we're talking about vitamins and minerals for overall health, and you get for overall general wellness. So supplements, what they do, as I said before, they help to fill the gaps when diet alone is not when diet alone is insufficient, which is happening more and more nowadays because of the rubbish and garbage we're eating, trans fat. So what do you do for general wellness, to optimal wellness? This supplement from Forever, they help to bridge the gaps, what is missing, in order to acquire optimal wellness. I hope you understand that. So aloe vera in our products. We are the biggest producer of aloe vera in the world. We produce over 90% of world aloe vera. And there are no rubbish aloe vera like the one here. It's the best one from Barbadensis Miller, according to research. What did you do? Contains what we call mucopolysaccharides. I don't want to get too much of this, which they are known to be anti-inflammatory. All these are very, very important. You can see all these ones, they contain fiber. They help to loosen all this fecal material. This is why they help to not to be, when you're taking, you don't become a victim of constipation. Fiber, they contain fiber and they are known to be gluten free. And when you're taking that, the other one, the fiber, I told you we have in Forever C9, contains 5 grams of fiber, okay? Fructooligosaccharides, forget about that big word. What do? They help normal movement of that muscular muscle in that area in the colon. And they contain digestive enzyme and essential amino acids. That's Forever Living Products. You can see all the benefits there. Those are the 10 reasons why you need to take this aloe. Even aloe, if you cannot take anything else, if you are taking aloe again, that will help you to making sure that you don't get sick. In addition, apart from taking other supplements. Again, some people say, oh, they don't want to drink. Let me tell you, if you don't take this one to detox, you're wasting your money by buying other supplements, because this one goes to help to detox the system, to help you with other supplements for maximum absorption. You can see in terms of detoxification, you can see this one there. This is how it works. So this video, some of you are familiar with it. Very, very important in terms of elimination of toxins to boost energy, and we acquire smooth, glowing skin. This is very, very important. That's how our Forever Aloe Vera from Forever. This is how it works. Now, this is very, very important. When we're talking about detoxification, in order to not to become a victim of colon cancer, which as is on the increase nowadays. So we have a pack called Forever C9, very, very important. That's the package, only for 9 days. Anybody coming to me, I always tell them, have you? No, some people even, no, some people, they don't. This is why it's important, this meeting, because many people, they don't know they live in a toxic world, and they don't understand the importance of detoxification. So I have to educate them. Here we have a packaging forever living product. It's a program for 9 days only. Can you just imagine, for natural cellular detox, and it's a natural cellular detox and a fitness program. You can see up to, you can see all the benefits here. People with bloating, all the things I mentioned before, it actually helps to eliminate that. So you can have a smooth bowel movement just by taking this for 9 days. You will see the difference. You wake up full of energy. I cannot describe it until you take it. For me, I do that 4 times a year. Because again, I don't eat rubbish. I'm very careful what I put in my mouth. But again, if I take anything inadvertently, unknowingly, and now this is why I detox. Okay, and it's very good. Start to look young. Let me tell you, it is that the feeling is indescribable. So those who are new on the platform, I would recommend that you take this you actually, you be on this program for general wellness. You don't have to be sick to take these products. We say for prevention, we're talking about prevention here. So in future, you don't become a candidate for cancer of the colon. So the CNI is designed to support natural body detoxification process by providing essential nutrients to enhance the benefits of exercise through restoration, repair, reset, recovery, and rejuvenation. What else do you want? Forever has already done it for you. They've done all the research. The only thing is just to use the products and feel good. This is what we're talking about. Okay, and you can see all the products, the nutrition supplement, they stop the anti-inflammatory. That means the antiviral, antibacterial, antifungal, and they are immune modulator. So they modulate the immune system. Very, very important, especially if somebody has been on an organ, had organ organ, if they've been through organ donation, they got so they need the immune system to be modulated. So it's not too high, it's not too low. Many of those people during organ transplant, they are on immunosuppressant drugs. This one helps to make sure the immune system is modulated and to make sure the digestive system is not in trouble. So they're also very good because they optimize cognitive function. We're dealing with the brain health here. And energy booster, because they increase the population of those, what I mentioned as the mitochondria. Improve sleep pattern, this is what I was saying. Support health, ethics. What else do you want? Promote general wellness, regular bowel movement, to ease with ease. Yours is it truly. No more struggling in the toilet, passing through like goats. So these are the things. Now, other products, because again, because of time, I will have to go quickly. Now, these are the other products in addition to our Forever Detoxification Program, C9, or if you don't want to take that, just our number one, that's aloe vera gel. So aloe vera gel. Already thrown the phone away. Aloe vera gel, sorry for that. So we have the propolis tablet, which unfortunately we don't have at the moment in Kenya. The propolis tablet is a natural antibiotic, which is from the bees. Okay, the bees, they do a lot of wonderful job. So it's a natural antibiotic from the beehives. This is for the queen bee. This is how the queen bee is able to live longer, no infection. So it's from the resin. Okay, again, I'm mentioning this because other people from other countries, they may have propolis. So for their benefit, this is why I put it on the slide. So the propolis tablet is very, very important as part of the supplements recommended for general wellness for the colon. And omega-3 fish oil is very, very critical because it stops inflammation. Remember, talking about inflammation of that area leading to ulceration. So it's very, very important. And again, your body cannot make it. Your body cannot make it. So we call it essential fatty acids. You can only get it by supplementation or from eating those oily fish we don't have here. And again, you have to be careful of the source, where you get your fish from. If you say all those like salmon, all those the other ones contain calamari, which is part of the omega-3 components from Forever Living products. Okay, the sea is so polluted now. I was watching. There was something I wanted to say to the team as well. Last week there was an information that all those some of the boats of the big what do you call it? The cruise, the people, those cruise ships. What they do? They were emptying raw sewage. Can you imagine? Raw sewage now far from the coast onto the sea. And you say we are recommending you eat fish. It's already polluted again and withdraw sewage because you have those unscrupulous operators in action. So now the only way is to be getting products, the good scientifically researched products from forever living products. That's our omega-3 fish oil. Very, very important, contain all those essential fatty acids. So that's very, very important because it's anti-inflammatory. Working together, synergistic together with the aloe, so you don't become a victim of inflammation. We have what we call Forever Pro B, which is very, very important for the digestive system. So if you want to have good digestive health, Forever Active Pro B is highly recommended. For me, I take one every day without fail. For anybody who is symptomatic, they need one in the morning and one at night time. Very, very important. That are Forever probiotic. Very, very important because it contains 6 beneficial bacteria, okay, for your digestive health, for good bowel movement, combined working together with the Pro B in our Forever Aloe Vera Gel. So we have fields of greens. Fields of greens is also they are in tablet form, and they contain a lot of minerals and like alfalfa, barley, no, so many things in beneficial nutrients. What do? They help to relieve constipation, and also they help to balance the pH. So it's not acidic; they're alkaline. Remember, cancer cells, they grow in acidic environment. So this one will help to balance. We used to have Forever Super Greens before, but unfortunately, because of, we don't have it in Kenya due to so many reasons. But in other countries, because you are listening to me from other parts of the world, so you can, if you have Forever, the Super Greens containing over 20 different vegetables and fruits, though it's highly recommended. So you can go, it's better than fields of greens. But here we have fields of greens, so it's very important. It's only we can hold on to at the moment to relieve constipation and to make sure that the pH is balanced because it's alkaline. So we have Lycium Plus. I love Lycium Plus. Lycium Plus is essential for digestive health. It contains what you call a lot of antioxidants like quercetin. Remember, I mentioned quercetin before when I was talking about those in red onions. Very important because it's a very important antioxidant because it helps to fight all those free radicals which can lead to cancer of the colon. So it's got many other benefits, but I want to move on. So we have garlic thyme. Garlic thyme is very, very important because it's got similar properties to our aloe vera gel. It's antibacterial, antifungal, and okay, it's got so many other benefits. Because of time, my brain is running too fast. So garlic thyme is very, very important because we put its garlic in a capsule. Okay, it's not like ordinary garlic, because if you're going to say ordinary garlic, by the time you open and you kill, and you cook it, you destroy the essential, the functional part of the garlic called allicin. So this one, the Forever one, due to research by Forever, we've added thyme, which is another powerful antioxidant to enhance the potency of the garlic, and they're in a capsule. So they only release when they get to this big intestine of the colon. Very, very important because they contain sulfur, and sulfur is very, very important for when you're talking about colonic health, to make sure we don't become a victim of cancer. So that's very, very important. You just have to take, with the garlic thyme, you take three capsules twice a day. But again, if they are symptomatic, there's nothing wrong in taking 4 capsules twice a day for people who are symptomatic. For everybody, is 3 capsules just before, immediately after food. That's for people who are not symptomatic. But if you are symptomatic, just increase it by 1. I hope this is good information for you today. We have vitamin C, which is also a super antioxidant. All these things, they help they are very powerful antioxidant to increase the amount of glutathione in the system. We have ImmuBlend here. ImmuBlend, which we don't have currently in Kenya, but they'll be available soon, I pray. But in other countries, if you have them, ImmuBlend is very, very important when we're talking about immune health. They contain all those essential mushrooms. They contain beta-glucan. For immunity, they contain shiitake mushroom, maitake mushroom, and they contain also vitamin D3, which is the trading when you talk about immune health. Okay? So very, very important. So you take 1 tablet twice a day. Now you have it. You can take nature mean. Your body. We need, our nature mean contains selenium. Selenium is a trace mineral antioxidant, together with other minerals with it, like magnesium, which is very important for bowel movements for the muscle. Okay, to help, to help that peristalsis, or to help that movement of the muscle. Very, very important. So nature meal is highly recommended. You take 3 tablets twice a day, and it's also very important, as I said, to prevent muscular cramps. So either that or Forever Daily. Forever Daily and Forever Daily contain over 55 vitamins and the minerals together bonded with aloe. So that's very, very important as well. And it contains CoQ10, which is an enzyme, which is very, very important for energy, for the mitochondria, which tend to be depleted because of the problem within the digestive system. So these are Forever Living products for you, which I'm highly recommended for general wellness, together with the aloe vera gel. Or if you're if you're on the, first of all, I always tell people, start on that C9, very, very important. So on the day 3 of the C9, you can start to take this supplement for general wellness. I hope you're all listening. So as I'm concluding here, because of time, I hope you're still there. The way forward, optimizing the colonic health, you have a choice. Life is about choice. Now, here you have, you either go this way, eating all this junk food, all this one, empty calories, or you can go the natural way, consume all these things containing sulfur compound for colonic health, as already mentioned. All these fruits and vegetables, very, very important. And you can see part of to restore colonic health, micronutrients. You have good fat, not those bad solid fat. Good carbohydrates, not those highly refined carbs. Make sure it's whole food, and again, and protein. This is what you call balance. Life is about balancing. Okay, and micronutrients we already mentioned. Quality rich preparation method. Then don't cook those vegetables. Don't boil them to death. Stir fry quickly. So you got the beneficial effect, nutritional balance there. Now, natural. Make sure the food you are containing. But no, we cannot avoid. This is why we need to detox. This is a nation where now they now introduced genetic modified. So this is why this is why cancer is on the increase, because of all this to be introduced in this nation. Let me tell you, for me, I don't quote any company, but I'm just talking because of research. So this is causing increase in cancer in this nation. People consume all this food, apart from environmental toxins they're already exposed to. So if you want, this is why it's important to detox, because sometimes you may take this without knowing. But if you can help it, go organic. Hoping that those who are selling organic food, they are scrupulous in their practices. Not selling those type of potatoes I mentioned earlier on, or in my training. Those potatoes, sangi, according to information, which is very commonly consumed in this nation, which are known to they are known to contain all those things that have been banned in Europe, those pesticides and herbicides. That's sangi potatoes. Okay, so like one farmer, then somebody they said they grow special one for their family, the one for the market. This is what they spray all the rubbish that we are not consuming. No wonder we are a sick nation. So these are the things. Make sure whatever you're taking is pesticide free. Well, this is why we need to detox. So avoid processed junk food. I'm coming to the conclusion. I hope you are all there. And if it comes in a box, try and reduce consumption. Anything that comes in a box. Our great grandparents, they never used to have cancer. Cancer was not what was not their problem in those days, because they don't consume all this junk food. Eat more plant-based diet, very, very important, fresh and organic. Limit consumption of alcohol. These are known as digestive irritants, causing inflammation. These are what's about coffee and tea, gut irritant, poor absorption of nutrients. And tea, they contains tannin, which binds to minerals. So you're wasting your money if you always tea. Try. All the minerals you're buying. If you say you have to buy products, minerals from Forever Living products, you're taking this. This for your knowledge. Take probiotic after a course of antibiotics. Very, very important. Avoid those antibiotics, especially to cause leaky gut syndrome and allergies. Avoid painkillers if possible. That's if possible. Use them for acute management. I'm not against. As a compliment practitioner, I'm emphasizing on this. I'm not against medication, but for chronic management, okay? So, because they are known to cause intestinal bleeding and leaky gut syndrome. Relax and take long, deep sleep, what I say for each meal. Don't eat everything in a hurry. Very, very important. And it's also very important to practice intermittent fasting to promote gut function. I'll be talking to you on this sometime in future about the beneficial effects of what you call intermittent fasting for good gut health. Lose weight. Again, not too much salt. Water is life. Make sure you consume a lot of water. Go for it. Not for me, I believe in diagnosis. Go for regular checkup, especially guys. No, guys. This is why many of them are dying of colon cancer because they internalize a lot. They don't go for medical checkup. They look after their cars than their bodies. So this is a good message for the guys on the platform today. Again, it's very important to connect with others. Very important for general wellness. Loneliness is not good. Learn to forgive. Be grateful to your creator. So, ladies and gentlemen, this is the end of my presentation. Those who are still on board on the platform today, thank you very much for your attention. And love you dearly. So I hope you will go out there, just for FBOs, go out there, talk, try to educate as many people as possible about the topic of today so we can keep a healthy nation. Reduce the population of those people dying from cancer, any type of cancer, not only about colonic cancer. To save those people being transferred to India, where they package them back in the coffin. Thank you very much. And if you have any question, Emmanuel, I hope you're on board.
Yes, I'm on board. There's a question there.
Okay.
Hope you can see it.
Uh,
Somebody's asking if one is not able to buy all the products, which ones are the most important ones for colon health?
okay. I will. The aloe is critical, as I cannot overemphasize on the beneficial effect of the aloe, as already mentioned. The aloe is a natural detoxification, as I showed in that on one of the slides. Very good for detoxification. So so the aloe is very, very important, and I recommend they take the that's our forever probiotic, working together with the aloe. Okay, very, very important. At least be taking one capsule on beadlet every day. Very, very important. And I will recommend they take the Imu blend, which I hope we have soon. Imu blend for immunity, and also the omega. Okay, the omega-3 fish oil. Okay, those are the ones that, again, when we're talking about making sure the pH of the system is alkaline to balance, I would recommend the fields of greens. Those are the ones. I think there are about 4 of them I've just mentioned now for general wellness. Are you happy with that? Hello?
Okay. I think she is.
Okay. All
Uh,
right.
I cannot see any other questions.
Okay, unless they are internalizing the information because I had to pass over. Okay. All right. Okay. Call about constipation. Oh my God. This one, the guy has called me about constipation for a 90-year-old man. I've told him about aloe vera. Okay. And they dismiss. Oh, you see, this is what we are talking about. These people, they say it's expensive. And then, but again, from experience, they say everything is expensive. But when it comes to being sent to India, there are many, they're able to get to package into India where they spend millions. So we are talking about, it's a decision in life. For me, Catherine, for me, as far as I'm concerned, you just pass on the message and move on. Like some people are coming to me today. I mean, nowadays they're coming, they say they wish they listened to me 10 years ago. Because now their health is being challenged. They're spending a lot of money going through doctors. And again, that problem they have is not going to be resolved because they are being loaded with chemo, which is very expensive. Some of them, they already been diagnosed with stage 4, which is very, very serious. So we are talking about prevention here. If they say prevention is too expensive, talk about the bill for all those, for the hospital bills. So for me, Catherine, just ignore and move on. Say next. All right? Anything else? Okay, if one is not able to buy, okay, I've already answered that. So there's nothing else. Okay, so all right. Thank you very much. Since okay, so compliments. Thank you very much for everybody for your attention today. So as I said, our products, they are not medicine, they are food supplements. Just make sure you look after yourself first of all. When you look good, those are the selling points. Okay. You can't go to people promoting all these products when you're not well or when your face is full of pimples because your digestive system is being challenged. Remember what I said, the effect. Huh? Okay, they change them. Okay, that's it. That's good, Catherine. Yeah, you put it on the pending list. Just tell them that they know where to find you. And move on. You always say next. It's next. Okay, so we close for today. Emmanuel,
Yes, yes, yes. We close for today. Thank you so much for everyone. Thank you so
you are
much,
more
Josephine,
than
for
welcome.
training.
Thank you very
Let's
much. Good night, everyone. Love you all. Good
okay. Bye
night.
bye. Good night.
Bye bye.
Bye
Bye
bye.
bye. All right. Stop.